So good afternoon, everyone, and welcome to the socialprotection.org webinar on Bridging the Divide, Tipsheets for applying the common principles on linking humanitarian assistance and social protection. We can move to the next slide. So before we get into it, a few session essentials. First things, this session is being recorded, and along with the presentation, it will be shared on socialprotection.org. And so also sent to all registered participants after the session itself. The Zoom AI generates automatic captions, so if you want to see them, you can just click the button down here on your bottom right, and you see a few options on it. Feel free to use the chat box to present yourself, make comments, or share useful links that you like the other people participated into the webinar to have access to. But please, for the questions, use instead the Q&A box. That will help me and the other presenters today to then collect your questions for the Q&A session. Next slide, please. So let's start with the introduction. My name is Federico Spano. I'm Social Protection Resident Officer at the FAO, and I will be your moderator. I work in this space since few years, so I'll be happy to moderate these sessions today. The webinar, as you know, is organized by the Working Group on Linking Humanitarian Cash Assistance and Social Protection of the Social Protection Interagency Coordination Board, also known as SPIAC-B. Next slide, please. So quickly on why we're here today, mostly because, as you all know very well, as crises become more frequent and complex, the need for stronger alignment between humanitarian assistance and social protection becomes more urgent, even more now where we are in a moment of shrinking financing. This because enhanced linkages between these two systems can improve effectiveness and efficiency, and also ensure continuity of support for vulnerable people in time of crisis, plus fostering long-term resilience of national SP system. To unpack this topic today a bit further, we will introduce and discuss the newly published Tipsheets developed by the SPIAC-B Working Group, in line with the 9 principles to make the alignment between humanitarian assistance and social protection works in practice. Next slide, please. So in order to so, we have 5 practitioners with us today to share the reflection and on the applicability of these common principles and the related tip sheets at country level. Their intervention, as I mentioned before, will be followed by the opportunity for everyone to ask questions and engage in a dynamic discussion, but again, through the Q&A box in order to make efficient use of our time. Before we begin, let me introduce the lineup of speakers, which includes, first of all, Charlotte Bilo, who is the coordinator of the SPIAC-B Working Group on Linking Humanitarian Cash Assistance and Social Protection, and she will present the core principles and the related tip sheets. Next, we have Alexandre Gachot, which is the Senior Social Protection Officer at the International Federation of Red Crosses and Red Crescent Societies, IFRC, seconded from the Swiss Development Corporation, and previously he was Cash Assistance and Social Protection Coordinator with OCHA in Cameroon. And this is the experience he's going to talk about today. Alex also co-chairs, it's very new into this role, the SPIAC-B Working Group on Linking Humanitarian Cash and SP that I mentioned before. After Alex, we have Lukáš, which is the team leader at the Technical Assistance Facility of PeReHID initiative in Ukraine, seconded by the START facility. Then again, for the country level bit, we have Diana Tonea, Interagency Senior Coordination Cash Advisor to the Resident Coordinator in Lebanon. Finally, again, from reflection, but more at global level, we have Lara Phelps, Adaptive and Shock Responsive Social Protection Lead at the Oxford Policy Management. Can we have the next slide, please? Okay, here the flow of our hour together. First, we're gonna have Charlotte, as I said, then the 3 country experiences, reflections with Laura, and then 15 minutes of Q&A. So I will say, if you will agree, without further ado, we can start with Charlotte.
Perfect. Thank you, Federico. Yes, thanks everyone, and welcome again. Great to see many people introducing themselves in the chat. Please continue to do so. Yes, so I will be presenting today, obviously, the tip sheets. But before I do that, if we could go to the next slide, I just wanted to very briefly introduce actually the group, the SPIAC-B Working Group on linking humanitarian assistance and social protection. We are a technical group with members from over 30 organizations, including the UN, donors, but also all major INGOs working on social protection and cash assistance. And what makes our group, I would say, unique is that we have both humanitarian and development or social protection practitioners, which is great because obviously the aim of our group is to bring these two sectors together, as Federico already mentioned earlier. So you can see on the screen also kind of the 3 areas of work for this year, actually, which we decided on in Geneva earlier this year, which you can see on the picture. This is from our workshop in January. And yeah, the group actually has existed now for 7 years and has done a lot of work and a lot of products, including guidance notes, but also obviously events, webinars, and more general advocacy to promote the linkages between the two sectors. And if we could go to the next slide. Before I go into the tip sheets themselves, just taking a step back, why we should actually link humanitarian assistance and social protection. Again, Federico mentioned it earlier already, but we are, as we all know, living in a world of ever more protracted crisis. And at the same time, we see funding, especially humanitarian funding, shrinking. So this really requires new ways of working together more efficiently and more in a more sustainable manner to really meet the people, the needs of the people that we want to reach. Because if we think about it on the long run, stronger national shock responsive social protection systems will actually reduce the reliance on humanitarian assistance and increase the resilience of populations against shocks in the future, right? And another reason you could say is also that we do have a common objectives of the two sectors, which is, in a very summarized way, to provide assistance to people in need. And you can see on the screen, actually, on the visual, there are a lot of building blocks that are very similar between the two systems, especially if we think about cash assistance. So in terms of delivery mechanisms, registration, identification, and so on. So there's actually a lot of elements that where convergence and synergies are possible. So that just a little bit on the background. If we can go to the next slide, please. Yes, coming to the principles and the tip sheets themselves. Obviously, linking the two sectors is easier said than done, which is why we as a group in 2023 decided to come up with a document, which is our common principles document, which kind of sets out a framework for linking the two. So it's a very short document with 9 principles that we as a group decided on collectively that we want to pursue and advocate for. And based on this common principle documents, and last year we developed what we call the tip sheet. So the tip sheets are basically short documents, 3 to 5 pages each, one for each principle, which offer practical tips to actually implement these common principles at country level. So you will see that all of them are structured in a similar way. So they all have a short paragraph saying why this principle is actually important for linking the two sectors. Then the main bulk is obviously about concrete tips and actions that can be taken at country level to apply them. And then the last part is an annex with country examples, but also other relevant resources related to the principle. And you can see the annex actually on the screen, also the table of the annex. If we can go to the next slide. Great. So these are the 9 principles, the 6 first ones, actually. I won't go through all of them because today we basically want to focus more on principle 5 and 7. But just to say that the 9 principles and accompanying tip sheets, we divided them into, or by different contexts. So the first 6 we say are applicable actually to all crisis contexts. So you can see on the screen, for example, principle 1 is about identifying assessment or entry points, for linking, for example, a humanitarian response, humanitarian cash transfer to an existing social protection program. Ideally, this assessment is based on an existing social protection assessment. Principle 3, to take another one, is about the meaningful engagement of local and national actors, because we know these are often first-line responders, and those are also the people who actually stay in the country after the humanitarian community leaves, right? So it's really important to engage them from the onset. As I said, principle 5 I'll talk about in a second, but just to say that there's also principle 6, which is about M&E and learning. If we can go to the next slide, please. The remaining 3 principles and tip sheets are for specific contexts, which doesn't mean that they are mutually exclusive. Again, principle 7 I'll talk about in a second, but just to show you that principle 8 is about how to apply these principles in conflict and fragile settings, and how to do so in a conflict-sensitive way. And principle 9 is about displacement settings, so how to enable displaced people's or access for displaced people to national social protection systems, ideally. If we can go to the next slide. As mentioned, so we want to focus today on principle 5 and 7. Principle 5 is about building and strengthening coordination mechanisms that link humanitarian and social protection actors at country, regional, and global level. And in the tip sheets, and I think Isabella will post them in the chat, we have identified, or the group collectively has identified 5 key steps, so key actions. The first one is obviously coordination requires resources. Sounds kind of obvious, but it is really key to emphasize this because it requires people to run coordination groups and to really make them inclusive also, which also links to the second point. It is key to conduct a stakeholder mapping of the actors in the country, which should also be followed by an assessment of the barriers that different actors might face. So this could also include things like linguistic or cultural barriers to engage with international partners, for example. And when it comes really to then building or engaging in these coordination forums, we say that it's key, obviously, to build as much as possible on existing structures and groups, and not replicate or duplicate those. Then it's also key to keep a balance and wherever possible to ensure national and local leadership. And finally, and I believe Alex will actually talk a little bit about that from the Cameroon experience, is to develop a structure that allows, if needed, also for regional and local level participation. If we can go to the next slide. Thanks. Yeah, so this is principle 7, which is about making coordinated and complementary contributions to social protection system strengthening, guided by jointly defined plans while retaining the humanitarian space. So here, and again, there's more details obviously in the tip sheet. We're saying that when a social protection system is more mature already, both humanitarian and social protection actors should work together to, as much as possible, try to strengthen the shock responsiveness of those systems. And when the social protection system is maybe more nascent, then it's really about ensuring that ideally after the humanitarian response, caseloads are transitioned to the national system, and transition plan is developed jointly. So again, in terms of where to start, it's really key to conduct a capacity assessment to see also the capacities of non-governmental and informal, let's say, social protection providers, and to, again, identify the appropriate coordination platform. Federico, I see your face. I think I'm running out of time on my watch. I still have a few seconds. But again, the engagement here is really, which is really key, is to collectively, as international and national community, to build as much as possible on roadmaps or social protection roadmaps if they exist, and try to identify where, as a community, we can add value. And where no such roadmap exists, then one key action could actually be to support the government in developing one. And then lastly, it's obviously about building systems that are more shock responsive. I will stop here because we want to hear from our country experiences, or colleagues who have those experiences. So I think I'll hand back to you, Federico, and thanks.
Thanks a lot, Charlotte. And I think this was very useful to get an overview of what the principles are and what is the use of these tip sheets that we are soft launching today, right? On top of being already available. So moving into the first country experience, Alex, thank you very much for being with us today. And just to recap from your introduction, in your previous secondment, with OCHA in Cameroon, you were responsible to support the implementation of the new cash coordination model at country level. So my question will be to please tell us a little bit about your experience, and especially how it went in terms of linking this new cash coordination model with the national social protection system. Over to you, Alex, and grateful if you can stick to 5 minutes. Thanks.
Do my best, Federico. Thanks a lot. I hope you can hear me okay. So thanks for the invitation to share my experience from my previous SDC secondment in Cameroon last year. Thank you, Federico, for your question. So I currently work with the IFRC in Geneva as a senior social protection officer. It's a secondment from SDC, but my previous secondment was in Cameroon to OCHA in Yaoundé. And I was deployed there to specifically support the implementation of the new cash coordination model. As I'm sure most of you know, that this new cash coordination model allocates responsibility to OCHA to co-chair cash working group in non-refugee context, or EASC context. So to illustrate a bit this principle 5 of the common principle on coordination mechanisms, I'll share some highlights of this secondment in Cameroon. So with the other co-chair of the cash working group, which was WFP, we supported the stronger linkages between the national cash working group and the 3 subnational cash working group for the 3 crisis areas. So some of you might be familiar with the context in Cameroon, but there is the Anglophone, there's a crisis in the Northwest and Southwest region, the Anglophone region of Cameroon. There is insecurity in the far north, linked to the Sahel crisis and to the Boko Haram insurgency. And in the East region, which is hosting refugees from Central Africa, there's another crisis area. So the National Cash Working Group launched a task force on linking CVA and social protection as part of the rollout of the new cash coordination model in 2022. And that was in the spirit of Principle 5. So the focus in Cameroon was not so much on regional and global level, but really on national level and what we called subnational level, because of the different crises affecting Cameroon. So the Cash and Social Protection Task Force is led by UNICEF, with regular attendance from different UN agencies, different donors, including the World Bank, USAID / BHA, different international and national NGOs, as well as occasional attendance from representatives from government ministries. So in order to improve a bit, to further improve the engagement, we suggested that organizing face-to-face meetings occasionally in government offices could help improve the engagement between humanitarian actors and government representatives, because we all know government representatives are often busy and they might not be always available to attend these monthly or regular meetings. So the Cash and Social Protection Task Force provides a formal platform for dialogue between humanitarian, development, and government actors. And the task force identify opportunities for linkages between humanitarian cash and existing social protection and safety net programs. So we looked at both formal government-led social protection system, but also community-based safety nets to identify opportunities to connect better. So still on this slide, to illustrate Principle 5, in my role as co-chair for OCHA of the Cash Working Group, and as a member of the task force, I encourage national and local actors to participate in both the National Cash Working Group and the task force. I suggested specific topics to be discussed, including opportunities to support community-based safety nets, oftentimes considered as informal social protection, to complement the formal social protection schemes implemented by the government. And we know that in Cameroon, community-based schemes such as tontine or saving groups are extremely popular, and they do provide support in times of crisis. So the co-chairs, OCHA and WFP, we also ensure that the chair of the task force, UNICEF, provides an update on the ongoing activities of the task force during the monthly meetings of the National Cash Working Group. So part of my role was ensuring that we had the monthly meetings of the National Cash Working Group, and we also encourage the subnational Cash Working Group to also have monthly meetings. So trying to strengthen a bit the connections. Can you please, next slide, please? All right. So this slide is meant to illustrate a bit Principle 7 on make coordinated and complementary contribution to social protection system strengthening, guided by jointly defined plan while retaining humanitarian space. So I added this extract here, where social protection systems are still emerging. We call on humanitarian development actors to jointly support strategies to transition towards nationally led systems without compromising traditional coping systems or humanitarian principles. So here I mentioned the participation, and what was important is that, and that's also linked to the localization agenda. We wanted to ensure a more diverse participation, right? Have stakeholders based in Yaoundé, the capital city, but also have participation from national NGOs and also local NGOs. That was pretty important. I did mention the interest around informal, safety nets. So organizations like CARE and CRS that are members of the Cash Working Group were invited to present their experience in Cameroon, but also outside Cameroon. And we have an interesting discussions. So with WFP, we organized a CALP 5-day training on cash assistance. We invited government representatives, so they presented their safety net programs, and humanitarian actors outlined severe responses in the 3 crisis areas. So we also organized, I was one of the facilitators of this training, so we organized mixed group work to socialize the common principles, trying to see in Cameroon which principles apply, which principles can be used. So that happened before the tip sheet was produced. And I supported advocacy efforts by engaging with subnational authorities to better understand their concerns regarding CVA. Here we have a picture of a local representative presenting their how the national safety net program is currently being implemented. So these are a few activities that illustrate how the tip sheets have been used, particularly Principle 7. And I need another 30 seconds, please. Federico, next slide, please. And this is just an extract of the work plan, particularly Objective 2, that was meant on improving the understanding of national authorities on humanitarian CVA and the Cash Working Group activities. So we had the training, we had these subnational workshops that provided opportunities to connect. And the picture here, these are 2 pictures that I like. We have the head of WFP in the far north presenting their program, including some concerns that the local authorities had around mobile money. And on the right, we see the informal conversation during tea break between the head of WFP and the representative of the local authority. Thanks a lot. Over to you, Federico.
Thanks a lot, Alex. I know it's difficult to pack everything in 5 minutes, but I think this was very very useful to understand the importance of like some subnational engagement and especially with government counterparts, right? To engage them in a meaningful way, being aware of how busy they are and how difficult it is to grab their attention. And also for reminding us about the importance of looking both at formal national SP system, but also community-based safety net, which are something we can build on. Okay, so moving to the other country experience we have today, let me ask Lukáš, to what extent was the humanitarian response in Ukraine coordinated with the national social protection system, and how did this coordination contribute, if at all, to strengthen the national system? Over to you, Lukáš, and again, if you can stick to 5 minutes, that will be great. Thanks.
Thank you, Federico. Hi, everyone. So I'm Lukáš. I served as the team leader for the technical assistance facility of the PeReHID initiative in Ukraine, seconded by STAR facility. And actually, the PeReHID initiative was set up in order to facilitate transition or better linkages with the social protection system. So we are looking into the nuts and bolts of actually making this happen, and we had, of course, a lot of challenges. We had a very good collaboration, though, and very good participation of the partners that you see at the bottom of this slide. So various UN agencies, but also donors, the government of Ukraine, and national and international NGOs and networks such as CCD. So that was quite helpful. But of course, we were facing different challenges, and I think it's convenient that Alex covered the humanitarian side of the reaching out to actually link. And I'll try to look a bit into what actually needs to be, what are the preconditions on the social protection side for the linkages to be effective. So for the principle 5, which is really about, as we learned from Charlotte, building coordination mechanisms that do the linkages and that work on different levels. For us within the initiative, we actually identified kind of 2 recommendations and key actions that resonated with the CAP. So basically that we identified. So one of them was really national ownership and the role of the government in the process, and it's really a default that the government needs to be actually able to participate and be present in the humanitarian architecture in some way. Obviously, we are very aware this is context specific, and that in certain contexts this is not desired. But that this participation also needs to be meaningful, meaning that there has to be operational capacity to do that, and so enabling the access and then moving actually from there. And then the problem that for me it's great for the tip sheet that it reacts to it straight on is really often the lack of coherence and coordination between the different stakeholder groups, government, humanitarian development actors, on the topic of the humanitarian social protection nexus and these linkages. And to basically get there now in the blue frame, for us the main learnings were to pick the right forum where
Sorry,
the
Lukáš,
social protection.
to interrupt you, just if you want to share your screen, I don't know if you meant to stop sharing.
Oh, I am sharing. Am I sharing it or not?
For me, it's still showing, Federico. Maybe it's
Okay,
on your end.
sorry, that is my problem. Okay, sorry.
Okay,
Go ahead, please.
thank goodness. So yeah, for us, one of the default realizations was that really having the social protection partners and the government organized is also essential, because however it is on the humanitarian side, we can always have opinions about the coordination. It is very structured, and you can rely on the partners to be there. Whereas on the social protection side, the assumption is always that the government is the one organizing this, and very often, especially in a context where we are seeing shocks and where there is a humanitarian emergency, there could be simply other priorities and capacity issues. So having an active and coordinated sort of a sector working group or a social protection working group and sub-working groups potentially that look specifically on shock responsiveness and other aspects, that was something that was for us essential and a key action that actually was taken up from the PeReHID. And another thing, and this is something that we were facing for some time is the inclusiveness of this mechanism. So is everyone at the table? Is everyone informed? We would get often questions, is the government going to go bankrupt? Is the social protection system going to hold? Which are questions very easy to be answered by IFIs and other partners that actually support the government on social protection. But these groups don't talk. So it's a question of inclusiveness, and that's one of the so to say prerequisites or key actions that we identified to actually bring the Principle 5 into life. But that's also what you can find in the dip sheet. For the Principle 7, the coordinated contributions, we actually experienced this on all levels. So basically looking at the overlap. So where is it that the social protection system has to come in to the discussion, and that's specifically on interoperability, and a lot also on the shock responsiveness itself. This is where the development and the humanitarian actors really meet. And whereas, of course, the technical assistance on the core systems that could be enabling, but they also may need reforms that are related to the pure social protection space. That's something where of course the time has to be invested, but there's not that much need for the coordination. It's really about the areas where the technical assistance delivered the interoperability measures, where the resources of the social protection system can be put at the disposal of the humanitarian response, and potentially the other way around. This is where for us it was quite essential. And then, of course, looking at shock responsiveness, as in how fast are the benefits delivered, how inclusive is the system, and also is the design of the benefits adequate to the shocks that the populations are facing. There is a little bit of an overlap in a sense, and I will try to speed up to meet the time limit. So we identified some fundamentals of the social protection humanitarian alignment that are common to the two principles, and these are pretty much the existence of the social protection working group. That is something that is really essential, because otherwise, obviously, there is nowhere to dock in for the humanitarian side. Then incentivizing, encouraging, resourcing the coordination as a prerequisite for these linkages. So that's something that we heard also from multiple partners. Often we have the government sitting in the middle, and then different IFIs and government partners coming in, but actually not knowing who is doing what, and that reduces value for money and makes it difficult also to build linkages, because there is not one single docking point to link to, but there is a need for ad hoc engagements, which makes it very inefficient. And then, of course, repeating the usual joint analysis of needs, definition of collective outcomes, planning, programming, financing must be encouraged and incentivized, resourced to ensure the coherence. And that links nicely to the next point. Role of the RCO and the HCRCs in bringing these different stakeholders together. In Ukraine, this was a standalone initiative, kind of coming grassroots from basically donors, UN partners, and NGO partners, and then bringing the HCRC in. But of course, it could be also led by the HCRC office or some sort of nexus advisory within that office, and that could be actually extremely useful for us. Very good lesson learned. And then levels. So we talked about in the tip sheet about the regional and subnational and the national and the global levels, but there are also qualitative levels. This is one of our learnings. Strategic, operational, technical. Sometimes we can have a strategic commitment, but no operational forum, or we can have a technical collaboration, but no strategic commitment. And if one of the levels is missing, then the actual outcome of this process of good linking, which is collective planning and basically alignment, could be compromised. And lastly, actually being concrete and looking into the nuts and bolts of it, looking at the TORs of the sector working groups on social protection, and specifically on the shock responsive social protection, to clearly set linkages with the humanitarian response as an agenda item, and enable inclusive participation also by the humanitarian response representatives, but also civil society actors, potentially think tanks and others that could contribute meaningfully to the conversation. So yeah, these were our learnings from the Ukraine experience on the fundamentals from the social protection perspective. Thank you so much.
Thanks a lot, Lukáš. Thanks a lot. And I'm glad that the others could see your beautiful slides. I was following them offline as I have them. So thanks a lot. I think you said a number of very important things, no? Reminding us about the importance of defining roles and responsibilities, create incentives for this coordination at different level, and consolidate docking points also with government interaction. I think this is really important. I'm sure there will be questions for you after in the Q&A session. So in order to not lose more time, let's move to Diana. So Diana, we know that in Lebanon, the level of coordination and alignment between SP and humanitarian assistance is still at early stages, right? Plus the context is getting increasingly complex nowadays. But given this, would you please share with us the applicability of the principles plus the tip sheets and the experiences that we have just heard from Lukáš and Alexander in the context of Lebanon? And again, thank you very much to stick to 5 minutes. Over.
Yes, brilliant. I hope I can make it in 5 minutes. As you all know, Lebanon is pretty complex, and I'm sure it's not the first time you hear that Lebanon is complex. But however, we really wanted to bring Lebanon in this webinar to show it as an example of how we could potentially apply some of the recommendations under the 2 principles, as well as some of the learning from Cameroon and Ukraine. Maybe just to start off by saying that we've recently just done a cash mapping, so we have over 10 different types of humanitarian cash interventions, mostly sectoral cash. We have 4 different temporary CVA emergency adaptations during the recent war in November, December 2024. We have 3 regular social protection programs and 2 shock responsive measures that were applied. Obviously, most of the cash programs are currently ongoing, and there is some amazing progress that has been done in terms of system building as per tip sheet number 5. However, unfortunately, social protection systems are still not there in terms of maturity. They are developing, although they're going in the right directions. You know, we're looking at developing a single registry, as well as adding some rights-based social protection schemes. Lebanon has also a clear roadmap in terms of having adopted a national social protection strategy, and this is very much aligned with tip sheet 7, where we really need to put a lot of effort to build the local systems as well. Some pros and cons. Obviously, we all know that the Syrian population is de facto excluded from the national social protection systems. So therefore, we do have a parallel humanitarian program that is running at the same time. There's also a big ongoing pressure to reduce the humanitarian program targeting Syrian refugees and shift to returns program. Now, I want to share 4 challenges that we currently have. Unfortunately, there's still a lack of intersectoral cash coordination. So I can touch upon briefly both on the humanitarian and the social protection side. So our first priority now is really to reinstate the cash working group that has been phased out a while ago. As of November 2024, we have a clear mandate to establish linkages with social protection across all humanitarian cash interventions, including sectoral cash. And then again, I mean, here I think it's worth reflecting on the role and importance of having a cash working group in coordinating the whole process and ensuring there's linkages between humanitarian cash and social protection. And very much in line with tip sheet number 5, which argues that having a robust cash working group is still critical in having, like a starting point into these conversations. Challenge 2, social protection governance. So we already have a structure in theory that has been designed as part of the social protection national strategy. However, unfortunately, has not yet been fully rolled out. It has been put on hold now during the ministerial transition. As you may know, there has been a government change. This means that some of the social protection interventions are being reported and coordinated under humanitarian sectors, such as for example, basic assistance. So here a reflection how to revive the Social Protection Forum or Social Protection Social Assistance Committee under the Ministry of Social Affairs. So how we really need to get these forums up and running and move all the social protection conversations from the humanitarian space into the more appropriate technical fora. Obviously, we also need to establish shock responsive pillar and bring in as well humanitarian actors into those conversations. Linking humanitarian cash to social protection. Again, unfortunately, there's no coordination body that brings all actors together, with most discussions happening in parallel. So whatever we see on social protections, we have a few brilliant agencies that are doing amazing work to advance some of these systems. However, discussions are happening in parallel. Very similar to on the humanitarian side, all sectors are discussing that in parallel with the Ministry of Social Affairs in terms of designing and implementing their cash and voucher assistance. A reflection here, where do we place this coordination fora that builds on existing structures? For example, the Social Assistance Committee, that is still not yet up and running, but it exists in theory. Cash Working Group, is it at the ICG? Do we need to create a specific forum to enable and discuss linkages between humanitarian cash and social protection? What I have learned, obviously, from my position as interagency senior cash advisor that sits with the resident coordinator team is that we need, having one role and one position dedicated to this is not sufficient. So we really need collective ownership, making sure that these fora are institutionalized so that there's systematic engagement across all sectors. And finally, again, we really need to continue safeguarding the humanitarian space. We've had some hard lessons from the recent war. We do have a social protection dominated space here in discussions here in Lebanon, which is positive. However, the shock responsiveness is still not there yet. What we have learned is that the cash response was really was not able to reach most of those affected by the war. During the massive displacement, I think it peaked 1 million people at one point. The response was led by a few agencies who had access to lists and MOUs in place. But the majority of humanitarian actors who wanted to do cash assistance as emergency response they did not have access to data, did not have access to lists. They didn't necessarily have a common emergency MPCA guidelines. And there was also a big shift towards in-kind assistance during this time. So just a final reflection on this. So in line with tip sheet 7, yes, we are building shock responsive, we are building social protection mechanisms, but we also need to make sure that we preserve the humanitarian cash space to ensure that there is that space when the systems are overwhelmed. Thank you. Over to you.
Thanks a lot, Diana. Thanks a lot. Very interesting to see how complex it is to land this coordination in the existing structure already at country level, and thanks for reminding us to safeguard the humanitarian space. So moving to our last speaker, so to keep a little bit of time for our Q&A, Lara, can I ask you to please reflect based on the country experiences we heard and other experiences you have also on what is needed for more effective coordination and joint system strengthening? Thanks. Over to you.
Thanks so much. So what I'll do is I'll speak to the previous speaker's experience, but also talk a little bit about what we found when we conducted some research, which was commissioned by the SPIAC-B Group and FCDO. So it was on synthesizing lessons learned and promising practices, looking at joined up humanitarian cash and social protection coordination. Next slide, please. I think one of the things that's really important when we're talking about coordination is just to recognize that coordination is not a singular thing. And when we were doing the research, which was across 6 countries, including Cameroon and Ukraine, but also OPT, Colombia, Philippines, that we could really see this great range of ways of working. And the majority of the coordination is happening in that coexistence box, the kind of information sharing, but not really collaborative, cooperative ways of working. And that is really fundamental to these principles. Next slide, please. So these are kind of some of the things that we found around effective coordination and joint system strengthening. And these have already been touched on by some of the previous speakers. So the dedicated and sustained donor incentives, you know, the if not, why not approach to engaging in social protection, not necessarily creating parallel humanitarian cash systems where there's not a need for that. And of course, sometimes there is a need for that. The technical and strategic skills are really important. You know, it's not just about the technical, but it's also that strategic engagement to sort of analyze, design, deliver, and advocate, to making those linkages through the coordination mechanisms. We saw as well that mandates are really not a limitation for organizations. Nearly every organization has a mandate that says clearly that their goal is to better link humanitarian assistance and social protection. But it's the application of that at country level, some of which is linked back to the incentives or not created by the donors. We heard a lot from people that they wanted a shock responsive first approach, so really try and make sure that those systems have been analysed, and where feasible, that humanitarian cash can be delivered through existing systems, leveraging existing systems and strengthening those rather than creating and reinforcing parallel systems. But again, where applicable, not everywhere. And, you know, the importance of enhancing national leadership. That leads into the next point, which is around supporting governments as duty bearers, importance of their role in, you know, which is often overlooked by humanitarian actors. And that might require more time and investment to engage with them. There can be language barriers, there can be resource barriers, and the importance of that and making sure that they're very much engaged and involved in coordination mechanisms where feasible. I hate to call out one single IFI, but the World Bank was highlighted as the, you know, lots of people feel that it would be really helpful if they played a more facilitatory role. Now, the reason they've not done that is because they don't have a humanitarian mandate. You know, they work in the development space. They fund just over half of social protection mechanisms globally, but their role is important in making those linkages and bringing the government representation. And they are moving towards this more joined up approach and thinking. We looked both at nexus coordination groups that had evolved outside of the humanitarian architecture and ones that were developing within the humanitarian architecture. So the cash working groups, you know, Alex was talking about the IASC structure and the evolution of the cash working groups, and they often have subgroups or task groups that are focused on these linkages. But there are also groups that have been evolving outside of those cash working group structures, which often have quite a specific focus around both the technical and the strategic engagement, and really building trust and developing common languages and sharing, you know, better ways of working to try to understand what those barriers are and overcome those barriers and work towards a more collaborative approach. Next slide, please. So here I think you will see a lot of the points that have already been raised by previous speakers around the principles 5 and 7. You know, the importance of these enabling and the barriers that that sometimes limit us around the ways that we work. And I imagine that lots of you will be very familiar with these. Please excuse the typo in the first column. It's supposed to say willingness. But, you know, these are important elements that can undermine or strengthen the way that we work. And so really, really important to be aware of and not to underestimate in working towards these goals. So that's it for me. I'll hand back to Federico.
Thanks, Laura. Thank you very much. I think this was very, very comprehensive in terms of analysis, and please, everyone, do check the chat where you have the link that where part of what Laura presented is available in terms of like the document produced. So thank you again to all the speakers. We have now a few minutes, 9 minutes exactly, for some Q&A. So feel free to use the Q&A box that you see at the bottom of your Zoom, and I will start by addressing a couple of questions. I think all speakers can have access to the Q&A, but I will say I'll try to summarize what I've managed to do while I was listening to Laura. One interesting question, I think, is about the appetite of national governments to engage in this coordination, right? Again, this has to do with the incentives, but also the way to engage national actors that have different setups when it comes to, I mean, what compare with humanitarian actors. And there is also this alignment between having strictly national development actors and an international community, which is humanitarian. So this question, I think, it's applicable for anyone who wants to answer. That there is something more specific for Alex about the engagement of local actors, and more specifically, how did you engage with community level social safety net, right? How do you strengthen them? How you build on them? How do you leverage these systems? And again, a question from Carla that if I hope I managed to summarize well. A part of it at least is like at what level should the coordination take place, right? Should be at practitioner level, should be at strategic level. What is the best way to make it happen and function mostly? Related to this, like a lot, I mean, there is few lines in here specifically looking at the role of the residence coordinator and the humanitarian coordinator, which obviously speaks mostly to the UN system. So if you don't mind, we can start with Alex that I see there already on camera, and whoever else among the speakers wants to speak, please raise your hand and then you'll go next. Over to you, Alex. Thanks.
All right. Very happy to see the interest and the questions from Ettore, from FAO, and also from Amadou Diop, who's also seconded from SDC. So Amadou, I've tried to answer your question in writing, so it's there. I'll let you have a look, and I'll try to answer the question from Ettore. So how did you manage to get local organization actors involved? So there are several coordination mechanisms in Cameroon. So first we harnessed these, including the one between OCHA and NGOs, right, including international and local NGOs. So we communicated about the cash working group, and we encourage national and local NGOs. And I try to make the difference: national NGO having a nationwide remit, and a local NGO that operates locally in a specific crisis area. So first we mentioned like, hey guys, there is this coordination platform focusing on cash assistance, the cash working group. And in addition to this, there is a task force under the cash working group. So this is also how we raise interest. When we organized the 5-day CAB training at national level, we communicated first about this opportunity, and we asked international NGOs if they would be willing to subsidize or to cover the cost from local actors. So that enabled local actors to travel to Yaoundé, spend 5 days, and to take part in the training. The CAB training was organized free of charge, thanks to the participation of different actors, including lead facilitators from CARE. So in that way, we managed to cut down the cost, and we organized the training in our building, in OCHA building. So that way, because otherwise the training could be quite expensive. And your question, Amadou. So we didn't really have I would say there were formal discussions between governments and community-based mechanisms, but first there was an acknowledgement from government officials that the coverage of government-led social protection system in Cameroon was extremely limited. So there was a need to complement this by looking at existing community-based structures. So that's first. And my suggestion to have a conversation specifically on informal safety nets, informal social protection or community-based safety nets was validated, and we actually had 2 sessions specifically on this. So I'll stop here. Thank you.
Thank you very much, Alex. I don't know, Charlotte, I see your camera on. You want to come in on another of the questions?
I mean, if the country speakers want to come in, I would like to give them the preference, so to say. But I was maybe just one quick reflection, and maybe Laura wants to actually come in based on her research on where to situate this coordination group, I think as Carla was asking. I think as the SPIAC-B Working Group, it's something that we've been discussing a lot. And yeah, as Carla also mentioned, the role of the RCO obviously has come up, and we've discussed that in our group, that this would, maybe be ideal in terms of kind of the overarching, let's say, authority of the UN, at least for the international coordination on that part. But there's obviously downsides to it. But I was just, maybe Laura, based on your research, if you want to come in on the different models, because I think it depends ultimately, of course, a lot on the context. And we've seen very different types of coordination groups, right? So I don't know, Laura, if you wanted to come in on that, maybe based on your research.
Sure. So the countries that we looked at, we had the IASC cash working groups, the new structure that had been rolled out. Its functionality varies hugely according to capacity of the teams. And, you know, people like Alex have been seconded and supporting that structure, and that's working really well, or that's happening. But, you know, what we see is that, you know, when people move on, there's not necessarily a sustained capacity. And also we see that those subgroups, those technical working groups, or the subgroups, they often are technically focused. And so I think that's fundamentally been why there's been this evolution of the coordination platforms, the nexus platforms that sit outside of that humanitarian structure, because there's this demand for this more strategic engagement from donors that's a higher level, but also the technical elements to you know, enable those linkages. And the difficulty here is that you tend to have humanitarian cash or social protection people, and you don't necessarily have the skills that cut across both to understand what that would look like if it was more joined up. And so you need the right people. And you need to build trust and between the different actors as well, and common understanding. And that just takes time and energy. And the problem we have is often that people are doing this as a double, triple hatted role from their organization, and they don't have either the skills or the time to engage in the way that's required. So these, you know, separate nexus groups have evolved because they are resourced in a way that enables the person to do that. So that's for example, the role that Carla has been playing in OPT under the social protection CVA technical working group there. Now, where they sit, I don't have the answer for you. There's definitely huge demand within all the countries that we spoke to for there to be a greater sense of joined up thinking between the RCs and the HCs at country level. And there does need to be a decision on what happens with this, because if you have a nexus group that sits outside of the UN mechanism, that's a challenge in itself, even if it is very effective. So, yeah, I don't have all the answers, but definitely an interesting space to watch.
Thanks a lot, Laura. This is very useful indeed. So we reached 3 p.m. at least in Rome time, and but I see that Lukáš is typing into the $1 million question that we got from Raquel, I hope it's the right pronunciation, which is about graduation, how can we do graduation in fragile and conflict affected context. So I don't know, Lukáš, if you want to quickly comment on that, and then I think our time is up.
Maybe it's easier to actually say it instead of me typing forever. You know, I was actually writing that I guess it really depends. And for me, this was one of the highlights from Ukraine on what is already available in the social protection system, because of course major social protection systems include graduation, and they have labor market policies, active and passive ones, that actually enable that. And in case someone is falling through the cracks, so to say, then the system is carrying them and then trying to bring them back to self-reliance. So in that sense, the graduation model or the graduation approach in the humanitarian development side is like non-governmental iteration of this that of course works standalone. And for us in the Ukraine experience, it was really like understanding what is already out there, what is available. Like when you're going through a shock, where is it that you can land and which carries you? And then are there also instruments that bring you to self-reliance and graduate you out or not? And of course, there are contexts where they are simply not present, and we just have to, rely and utilize the elements that are already there and cover the gaps. So to me, that was a little bit the logic of what I wanted to say to Michelle.
Okay, thank you very much, Lukáš, and thank you again, everyone, to all the speakers, all the participants. I think this was very, very nice, and all participated. Our time is up again. Would have been nice to speak longer. I'm sure there is still a lot of questions, but please be in touch with the speakers. You'll find them on LinkedIn with no problem. Before you disconnect, just to kindly ask you that you answer the survey that will be, I guess, will pop up now. So this will be very useful for SP.org colleague to learn and collect suggestion and make it even better next time. So again, thank you very much from me and from all the speakers, and see you next time.
Bye-bye. Thank you, everyone.
Thank you. Bye.